Hi everyone. In today's clip, I want to talk a little bit about body's acid-alkali balance. Please note that anything I record here are for informational use only and is not intended to diagnose or cure any ailments. Acidity and alkalinity are measured according to pH or potential of hydrogen scale. Water, for example, that has a pH of 7.0 is considered neutral, meaning it's neither acid nor alkaline. Anything below 7 is acidic, and anything above that is alkaline. The ideal range for our body is between 7.35 to 7.45. We can do a self-test at home to determine the acid alkalinity levels of our bodily fluids with something called a litmus paper. We can buy this basically from any local drugstore. You can apply the saliva or urine to the paper, and based on the color it turns and the comparison chart, that color chart that comes with it, you can measure the acid alkalinity levels. Now, the test always also has to be before you eat or drink anything in the morning, and too acidic or too alkaline are both actually points of concern. When the body is too acidic, this is called acidosis. In this case, you'll find the person is sighing frequently. They experience insomnia, water retention, recessed eyes, arthritis, migraine headaches, abnormally low blood pressure, strong perspiration, dry, hard, or foul-smelling stools, followed by burning sensation in anus, alternating constipation and diarrhea, halitosis or bad breath, burning sensation in the mouth or under the tongue, tooth sensitivity to sour or acidic fruits, and so on. So we have two classifications for acidosis. We have respiratory and we have metabolic. Respiratory is caused by interruption of the acid control in the body. It happens if the lungs are not able to clean up and remove carbon dioxide properly, maybe because of asthma, bronchitis, or any kind of obstruction in the airways. Metabolic happens when there are chemical changes in the body that disturbs the balance. For example, ailments like diabetes, kidney failure, excessive use of aspirin, liver or adrenal disorders, stomach ulcers, improper diet, malnutrition, obesity, ketosis, anger, stress, fever, fear, and few other ailments or emotions can disturb the balance. One very important nutrient to help bring the balance back in this case is called trisalts. Of course, there are other considerations, but this being the most needed at the time. If acidosis is the issue, we will need to have a diet which is 50% raw foods because they are rich in nutrients and easily digestible. Recommended foods at this time would be something like apples, avocados, grapes, lemons, pears, pineapples, strawberries, and in general, all vegetables. In addition to this, we need to limit our protein intake to less than 80 grams a day and make sure to chew food slowly and mix with saliva properly before swallowing. Don't drink any fluids while you're having meals, and don't eat processed foods or late night snacks, basically. You can also drink a daily dose of potato broth, which is very good for this, and try and stay away from animal protein and practice deep breathing. Now, the opposite side of this is alkalosis, where the body is too alkaline. This is, of course, a whole lot less common, and if it does happen, it overexcites the nervous system and it impacts the peripheral nerves. So the person may experience hyperventilation or even seizures. Less severe conditions that can come out of this are something like sore muscles, creaking joints, bursitis, drowsiness, protruding eyes, high blood pressure, hypothermia, edema, allergies, night cramps, asthma, chronic indigestion, night coughs, vomiting, thick blood, skin thickening, itching sensation, bone and heel spurs, and more. And all of these can be because of alkalosis. Now, this condition can also happen if the person is on alkaline substances like sodium bicarbonate, for example, for some reason. So to reverse this, things like MSM, alfalfa, betaine HCl are very helpful. Also, the things to be avoided are antacids and mineral supplements and sodium at a time like this. Please ensure to consult your healthcare provider and don't self-diagnose. I hope this has been helpful. Like and follow for more. Be the light.